Hello and welcome to Health Professional Radio. Thank you so much for listening today. In the world of healthcare, the nurse is normally the second line of defense, especially if first responder is involved, the EMT or maybe the police or the fire department. When they come to the ER, the nurse is the next one to have hands on, or maybe the first line of defense before seeing someone's healthcare provider. Our guest in studio today is Dr. Leah Curtin. She's a strong advocate for improving the quality of patient care, especially from a nursing standpoint. She's here today to just talk with us about some of the conflicts involved when doing what is good and doing what's right for the nurse, and the difference between sometimes what is legal and what is the right thing to do. How are you doing today, Dr. Curtin?
I'm doing just fine.
Thank you so much for lending us some of your time.
Well, thank you for asking me.
Now, as I said, you've been hailed by many as a living legend in nursing, but by the American Academy of Nursing and internationally recognized nurse leader, ethicist, and advocate, as I said. What prompted you, first of all, to go into nursing in the first place?
Well, what prompted me was I wanted to do something good with my life. I wanted to be able to physically improve things for other people, and emotionally and also spiritually too. And nursing offers all three of those things, or at least the opportunity to do all three of those things.
Well, there's lots of stress, of course, dealing with life and death situations on a daily basis, or even if you're not in the ER, just dealing with the day-to-day routine and responsibilities of someone who has such hands-on contact with patients. The moral issues are bound to come up. Sometimes you can't go by the book. You have to throw the book out and go by your instincts, maybe twist your training a little bit to do what's right and what's good as far as the patient is concerned. Am I right in that assumption that sometimes you can't always go by the book?
Well, sometimes you don't even have an opportunity to go by the book, and that's for sure. But I'd like to make a little distinction here, and that is that ethics and thinking about what is the right thing to do in a given situation, that has to do with analysis, and it has to do with thinking through things. And the biggest thing is thinking through things, whereas morality has to do with decisions I make about myself. Ethics has to do with decisions I make about other people.
Great. Thanks. That's excellent. Excellent clarification. Thank you much.
And nurses, well, we face the same problems all human beings face, but we maybe face some of them a little more often because we are there with the patient 24 hours a day, 7 days a week, certainly with the institutionalized patient. And many of our problems come up more in intensive care than they do in the emergency room. In the emergency room, it's pretty clear. You're there, right there, and you do what needs to be done the way it needs to be done as quickly as you can. Whereas in something like an intensive care unit, you've got an extended situation, and you've got time to make decisions, and you've got the ability to see the results of the decisions that you make and that other people make. And oftentimes, families have time to tell you what they want done. Patients may or may not, depending upon the condition they're in, have the ability to tell you what they would like and what they wouldn't like. But oftentimes in emergency situations, there is no time for such reflection. But in intensive care or in long-term care or in hospitalized patients in general, on general medical surgical wards, there is time to think through things.
Well, now, not being a nurse myself, when it comes to your training, aren't there contingencies for just about every situation where you can, as you go by the book? Don't they, lend some credence to there not being any time, having to make a split decision and say, well, if this happens, then do procedure A. If that happens, do procedure G.
If they think of everything, many times what happens is that the books don't cover the problem. The books don't say everything you ought to do. That, and of course, we have nurses prepared at many different levels. We have nurses prepared at 1 year of preparation, our licensed practical nurses, and we have nurses prepared at the doctoral level who have a baccalaureate and a master's as well as a doctorate. And you can see where the problems and the thinking and the training and the education are very different.
Now,
we have different problems.
Now, that being said, and understanding that there are different problems associated with different levels of training and experience, does the industry as a whole hold everyone responsible at the same level, regardless of their training, as far as ethics and morality is concerned?
There is a code for nurses that is promulgated by the American Nurses Association, and it pretty much applies to all nurses in the United States. And so that the answer to that would be yes.
So if something like that is in place, I mean, are we talking spirit of the law or letter of the law that is most often taken into consideration when there is a problem? Or does it depend?
What's legal and what's ethical are not always the same things. For example, if you happen to live in Oregon, the patient can choose what is called physician-assisted suicide.
Okay.
But if you happen to live in Ohio, that choice cannot be made. So if you are in, let's say, Oregon, you can take care of a patient and assist him or her as they take their medicines for themselves. That's the key to these bills. The patient takes the medicine himself or herself. No one, no physician, no nurse gives the patient a legal overdose. The patient may take it, and the physician may prescribe it. And but if you live in Ohio, that's not an option.
Now, if you're living in a state where that is an option, but morally you don't subscribe to that ideology, can you, I guess, opt out or refuse to, for lack of a better term, do your job if you're asked to do that?
When there is a problem of conscience, in almost any institutionalized or organized setting, someone else can take care of that patient and not the nurse who has a moral objection to it. So it isn't that the patient doesn't get the care. The real question here is this. What do you call moral? Moral is doing what you think is right. Not even necessarily what I think is right. Not even necessarily what the law thinks is right. It's doing what you think is right. And what, therefore, is the opposite of moral? It's immoral, which means doing what you think is wrong. Do you understand what I'm saying?
I do. And so it has.
Now, how many immoral people do you want taking care of you? Exactly. So it's much better to find someone whose thinking is in keeping with the patient's thinking than it is to try to strong-arm someone in doing what they believe to be wrong.
And this is also, it swings both ways as far as the nurse or nurse practitioner deciding for themselves what is right and the patient deciding for themselves what is right. When there's a conflict, you say that oftentimes there's someone else who can step in.
There can be, or you can reach a negotiated way of dealing with an issue.
In your experience, having a lot of experience training with nurses, dealing with physicians, EMTs, the entire gamut of healthcare, in your experience, how do nurses deal with this conflict? Sometimes having to go through with something that they felt was morally against what they felt was right.
Well, fundamentally, if they do go against what they think is right, then they have just made themselves immoral. You understand? By their own definition. So that if we're trying to preserve the integrity of the practitioner, we have to understand there are rights. Patients have rights, and nurses have rights, and physicians have rights, and some of them are clearly outlined in the law, and some are not. And the law, by the way, is not always right, but we'll get back to that at some other time. But the real issue for the nurse, when facing a problem he or she believes is against his or her conscience, is to act in the best interest of the patient insofar as humanly possible.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio today talking with Dr. Leah Curtin, the executive editor of American Nurse Today, the official journal of the American Nurses Association, and a clinical professor of nursing at the University of Cincinnati College of Nursing and Health. She's authored 360 articles, primarily published in peer-reviewed journals, and more than 450 editorials, and has authored or co-authored several books for nursing professionals on topics such as nursing delivery models and nursing ethics. In 2009, she was declared a living legend in nursing by the American Academy of Nursing for her extraordinary and sustained contributions to nursing as a role model and as the positive impact of a career in influencing nursing and healthcare overall. It's been great having you here with us today, Dr. Curtin.
Thank you. Thank you very much.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. And you can subscribe to our podcast on iTunes.